Our challenge is to essentially interpret these seemingly disparate data points, to integrate them, to make them clinically useful for patients in the here and the now.
So my name is Dr. Lombard. I've been a neurologist for almost 30 years, and I am one of these neurologists that people say, if we can't figure out the problem, go to see Dr. Lombard. And the reason that I've been successful in my career is because I'm both a writer as well as a neurologist, and have written several best-selling books about my experience as a neurologist. The absolute single most important aspect when approaching a patient is a differential diagnosis. If you don't have a differential diagnosis, you're going to miss things that could be very, very injurious to the patient's health and well-being. The best advice I would give your clinicians is to find the best neuroradiologist in where you live and develop a dialogue with them, because the neuroradiologist can only understand the clinical situation in the actual discussion with the doctor who's referring him that patient. The idea that you can do imaging in isolation from a patient history means that you're putting a disadvantage both to the patient, to yourself, and the radiologist. Very important to give that history to the physician. So the three most important aspects: one are the signs, two are the symptoms, and those things will lead to the site of the disease. The vitamin differential diagnosis for back pain is very, very important for your doctors to remember. V stands for vascular. Now remember, the spinal cord has the most precarious network of blood vessels of the entire body. Any type of contusional injury is likely to affect the vascular component. Now, a patient who has long-standing back pain and you look at the disc and the disc is degenerative, very important to ask the neuroradiologist if there's something called venous engorgement of the spinal cord. That venous engorgement is a sign that the lymphatic system is obstructed due to a venous obstruction, not a vascular destruction in a typical arterial sense. The second most important differential diagnosis in a patient with undiagnosed back pain is infectious etiologies. Many chronic infections can produce low-grade myelitis. You don't want to miss that, because you're not going to correct the patient unless you fully address the underlying etiology for that particular problem. And finally, the most important differential diagnosis, absolutely essential, is to rule out a neoplastic lesion. One of the most common things I see in my practice are patients with peripheral neuropathies. And peripheral neuropathies are not just one condition. One has to be very, very aware of a very important differential diagnosis for peripheral neuropathies, including vascular abnormalities and medications. Very often do a very important medical history. This may be reflective of your practice as well as my practice, but I'm seeing a significant number of patients who present with peripheral neuropathies. Now remember, peripheral neuropathies has many different signs and symptoms, and those signs and symptoms will help you lead to the site of the disease specifically. So always keep in mind that a peripheral neuropathy doesn't mean just one thing. It could mean a dozen different etiologies. Differential diagnosis is critical to evaluating a patient with a peripheral neuropathy, critical. So a mainstay of my practice is referrals from physicians across the world. And the reason I believe that I get these referrals from various physicians is because my reputation is to do such a deep dive into the etiology and the biology of a patient's condition that we can come up with very, very novel solutions for patients with very, very complex and problematic diseases. When approaching a patient, that you have to leave no single stone unturned. That means doing a deep dive into their medical history, a deep dive into their family history, a deep dive into their social history, a deep dive into their psychological history, a deep dive into their cardiovascular history, a deep dive into their neurological history, and only then at that point can you really arrive at a full understanding about what are the variable factors that are modifiable that can actually be corrected through a functional medicine approach.